I'm Mitch Fornecker. I live in Fuquay Arena. I went to Campbell. I graduated in 2019 from their DPT program, and I'm here at Habilitations in Raleigh.
All right. And what made you choose physical therapy as your path?
I didn't kind of figure it out until later in college. I knew I wanted to help people, which is, I know, the cliche thing to say, but um, I was a biology major. I knew I wanted to do something in the healthcare field. But later on, I added anthropology as a major. And then when I was doing like the osteology kind of stuff and like looking at the human skeleton and all that stuff, things started to click and come together. And then honestly, I saw online, when I was trying to figure out what I wanted to do, I saw like a list of like the most relaxed kind of employees, and like near the top was PTs, and I'm like, yeah, I'm kind of relaxed guy.
All right. So
So it
you chose
all,
it for its chill vibe and its use of the skeleton.
you got it,
All
you
right.
got
That's a
it.
great combination. So, on your journey through PT school, did you have any aha moments that drove you towards pediatrics?
I think I don't know if it was really an aha moment, but just shadowing before getting into PT school. The one that I kind of gravitated towards the most was pediatrics. Um, they're just, I don't know, it's just having to think on the fly sometimes, coming up with your own. You got to change things on the spot. Some kids are like, I'm having none of this, so then you got to like, switch it up pretty quick. But I just enjoy working with the kiddos, so it kind of felt like a natural fit from the start, really.
Great. And what have you enjoyed about being a clinical instructor in the pediatrics world?
It's been nice to see students I've worked with just grow from beginning to end. And it kind of makes me, increase my confidence that I know what I'm talking about. But it's really nice seeing someone come in and maybe our confidence is really low, or we're struggling with some concepts. And by the time they're done, um, that they feel you know that skill set has improved. And I like knowing if they are going into pediatrics that they're have a pretty good setup for starting.
Okay, fantastic. So, how did Campbell's DPT program uniquely qualify you for this job you're currently in?
The pediatric course, they did a really good job um, during my time there of just breaking down each diagnosis and like how you would treat and what you would look for and everything like that. So that was really good. Campbell had a pro bono clinic that was great, just kind of getting the just seeing how everything runs in that sense. And then I was very fortunate that I got two pediatric clinicals, one for my 6 week clinical and another for one of my longer third year clinicals. So that really helped me out, but it also helped that I knew I was going into that setting. Or I felt like I was going into that setting from the get go.
Okay, fantastic. So, what is it about the pediatric population that inspires you? Why should people choose PT when they have a loved one in the pediatric population?
I think, and this might go with the aha moment. When I was doing my clinical for for pediatrics, and I did it here actually. I remember I was like breaking a sweat. I was working with this kid to get him walking in a gait trainer, and then my clinical instructor, Dr. Goins, she said she was like, if it's this hard for you, just think how hard it is for them, and that kind of opened my eyes, and it's like, yeah, just yeah, just making a lot of these kiddos' lives as easy as possible, or just trying to set them up for success in any way I can. But just seeing, um, yeah, how a lot of these kids do day to day is um, inspiring, and working with them can be very rewarding.
Okay, and as a recent ish alumni, what advice do you have for current students who are still plowing through PT school?
Um, Try to remember, like retain as much as you can throughout school. It's very difficult. I remember some things it felt like they once a test was done, they were gone, and it was very important to just try to constantly keep that information fresh, because you'll use about all of it. And the other thing would be, for any setting really, is to have a mentor. I Dr. Goins is my mentor, and that's helped a great deal. And the staff that I work with have been great. I'm still asking questions all the time today, and I probably annoy people with my questions, but just have people around you can trust and you feel comfortable, you know, helping you learn.
Okay, so if that's our advice to the students, how about advice to parents who are considering physical therapy? Why should they choose PT for their children?
For their children. Just to really, especially with the really involved kiddos, just maximizing their potential, and um, some of these kiddos, just increasing that independence can be so important and so uplifting for them. So just doing whatever you can to increase their quality of life.